Reports reaching Eyeafrica indicates that the Fajikunda Health Center is experiencing shutdown due to the impact of the coronavirus global pandemic. The health facility, which serves about 10 different communities in both West Coast and the Greater Banjul area, is being fumigated time to time to ensure the safety of the staff. The Gambia has, since the outbreak of the virus in the country, recorded more than 300 cases with 8 confirmed deaths. Our colleague Ibrahima Presby is right now at the health facility, so give us update on this matter. Well, thank you very much, Ibrahima Presby, of course, for joining us this morning. Now, you are speaking to us live from Fajikunda. What is the COVID-19 situation like?
I mean, the Fajikunda Health Center right now are feeling empowered because today is the 4th day after the enforcement of the compulsory wearing of face masks by the government of the Gambia. So meaning that right at the gate, so the nurses and officials of this health facility are there to ensure that whoever is to get inside would have to put on the face mask. This is something that they are not compromising. So at the moment, the number as compared to before is not comparable actually, so meaning that very few workers, very few patients could be seen inside the health facility. So all indications are there to show that COVID-19 impact is really rocking in the health facility just like any other place, as the death toll stands at 8 in the Gambia.
Very well. Now, how important is the Fajikunda Health Center as we speak? Apparently, it's been shut down or whatever. So, how important is this to the community that are living around?
The health facility operates for more than 10 communities within the Greater Banjul area and West Coast. Actually, it is located in West Coast, but the proximity it has with the Serekunda, the Greater Banjul, so meaning that it accommodates more than 300,000 people who looks up to here for their well-being and their health. So this is a very important facility. And then on a usual ground, the health center here is known for being overcrowded, but thanks to the outbreak of the COVID-19, so things are changing. So what it means is definitely only COVID-19 that can explain this whole story. But as we know, the health facility offers maternity affairs. It also gives services such as child and health, child health nutrition services. It also has the OPD, that is the outpatient, where people with different ailments could be coming here to be treated for that. It also offers services just as the labor ward, so meaning that almost all the requirements for a health center are offered here. And looking at the number of people who look up to here for their well-being, meaning that Fajikunda Health Center is a household name in this area within the Greater Banjul and West Coast.
Yeah, it is indeed a household name, like you mentioned. Now, how could this, how could this facility be shut down now, as you're trying to explain?
Because of COVID-19, there are challenges now, meaning, the health facility is actually experiencing the worst case scenario, some point in time, knowing that it has isolation center. So people suspected of COVID-19 are always a reason for, alarm on this facility. So what we did, I spoke to the officer in charge of the Fajikunda Health Center, Kumba Jete, earlier on, and this is what she had to say in response to the
Yes, that happens sometimes. That is a challenge even to the staffs working here. Because normally, if you have a suspected case of COVID, even before confirmation, we will like to protect ourselves. That is by calling the team to come and fumigate the particular unit or the entire facility, because all the staffs mingle. So the fumigation, if it takes place like today, it will take us 72 hours before we resume work, because the chemical they are spraying inside is not even good for someone to live in it. So that is, I'm sure those are the challenges they are also facing, because these past days they've been coming here, but because of those fumigations, so we've been off for 72 hours. That's a problem for the community, I can say. So far, we have 3 suspected cases that are sent, and the last one was confirmed positive.
Out of 3 suspected cases, as he rightly mentioned, 1 has been confirmed positive, and this is not a good news for the health facility, because looking at the number of health workers who already under treatment for the COVID virus, I mean, they also are doing their best to make sure that the nurses and the few workers that they have here, since the work was scaled down, the number of staff was scaled down, they have to protect the few that are here. So they will go to the extent of doing whatever it takes to shut down the facility, just to make sure that, you know, the services that the community look up from them will continue to be offered.
Yeah, very well. Now, of course, Kumba have also talked about or mentioned about challenges, but what other challenges are being encountered at the health center, apparently?
One of the major challenges for the health center is the lack of security. For about 3 to 4 months now, the health center has to use its own regular nurses or public health officials to be in charge of the gate, meaning that security is a concern, because in this time of COVID-19, there is a need to have a rigorous control as to who comes in and who goes out of the facility, especially on night duties. This is a cause for concern. Kumba told me earlier on about this, but we hope to bring some of this in our later news bulletin to, you know, give a more proper update or detailed update about how is the lack of security affecting this health facility, especially in this time of COVID-19. So this is a major issue for the health center right now.
All right. Just lastly, before we let you go, of course, Press. Now, how is the situation like around? Are people coming and then, you know, eventually find that the health center is closed, and then they would have to go back home or find other alternative for treatment? What is the situation like as we speak?
For some days, because people have experienced a shutdown, but it normally lasts for 72 hours or so, meaning that those who have been told one day that they cannot come in because of that temporal closure will not want to come again, and then people will be coming with hope that, okay, today they will not be sent home. So this is greeted with mixed feeling for the people, you know, I mean, the patients coming in, but also it's supposed to be a very stressful situation for a patient looking up for a better medical care, only to be told that no, this is not your regular place. Imagine they come for nursing. Some of them are pregnant mothers. Some of them are, you know, with serious injuries. So people come here to complain instead of staying home. So they will come with hope that, okay, if they are admitted to come in from the gate, that is, you know, good luck they will consider themselves to have for the day. But as we speak right now, the number, because the staff are scaled down, not many people are at work. So in every ward where there used to be 2 or 3, it is now 1 operating there, meaning that the number of patients also has to be cut down for the cause of COVID-19.
The impact of COVID-19, of course, continue to cause more challenges for our health facilities. But for now, Ibrahim Presba, thank you very much for your time, and it was good to have you on the line.
You're welcome. Thank you.
Thank you very much. This was our senior editor and correspondent, Ibrahim Presba, speaking to us live from Fajikunda's Health Center.